Hi, I'm Ryan, student code s3656553. I'm interviewing Adam here in relation to, Adam, podiatrist, in relation to my case study for today. So I referred a patient with heel pain to you. How would you best manage that?
So I definitely start with obviously looking at the different positive factors, things like gait analysis, midfoot range of motion, ankle joint range of motion, taking adequate history, and then we look at things like exercise therapy, orthotics in the shoes, footwear changes if it's relevant, shockwave therapy as well, and some hands-on work making those solutions.
Cool. You mentioned ankle motion and foot motion, tarsal motion. What aspects are you really looking out for that would be significant factors for someone in your role?
Yeah, so I think the midfoot is a really big one in a case like plantar fasciitis. When we have a really restricted midfoot, we tend to have less shock absorption going through the foot. So getting those joints moving around the cuneiforms, the particular cuboid, really helps to take some of that load off the plantar fascia and allow the foot to move in its normal functional way.
Right. Now you mentioned some management strategies to help, manage plantar fascia or heel pain. Orthotics. What are your thoughts on orthotics? Do you recommend them often?
Yeah, especially for this kind of condition. So heel pain, considering it's not a structure it's not a muscle or anything that needs to be strengthened in itself. It's a lot about pressure and the way our feet are walking and the efficiency of our walking as well. So with an orthotic device, we can often redistribute some of that pressure to areas that might help to offload the plantar fascia, and that gives it that buffer to help get some healing into it.
Is there much more benefit between custom-made orthotics and just your, general ones you can buy that aren't custom designed to fit the patient?
Yeah, absolutely. We find that with pre-made or prefabricated orthotics, the average of the whole population made into an orthotic that has an arch, very generic arch. And while they're typically a really good option for someone who might be very cost constrained or just wants to trial an orthotic, we typically prefer the customized ones, which are obviously cost is a factor. But given that the arch is tailor-made to that person, and we can also add in modifications specific to that person's presentation, the customized ones are often a much better choice.
Okay, excellent. You also mentioned exercise rehab being an approach you'd like to take. Do you mind going in a bit more detail about that?
Absolutely. So with plantar fasciitis, typically it results in too much pressure, immersion pressure with the orthotics going through the forefoot. So that's usually from having really tight calves. So really tight calves tends to prop our foot up a little bit, even if we can't notice it that much, and puts more pressure to our forefoot, loading up that plantar fascia. So by strengthening the muscle, we can help get it longer and taking less pressure off that plantar fascia as well. There's nothing wrong with making someone stronger anyway, so low risk, high reward.
So one of the main things that you try and improve is that calf area. Are you doing any, more targeted strengthening work to the plantar fascia itself or some of those intrinsic foot muscles?
Yeah, great question. We do some intrinsic work as well. The main work we do is the calf, but the intrinsic stuff is really important as well. I like one called toe yoga, so rooting up our big toe and little toes independent of each other. It's a great one to do while at the desk. Raising up our arches to the point where just before it gets to cramp, and when we want to make it a bit harder, we can even add some TheraBand stuff in there as well.
Yeah, okay. You mentioned individual toe movement. I imagine that'd be pretty difficult for the general population to do. Is that something you prescribe for the majority of people or just those who are on that upper limit?
No, majority of people. Often I get people to cheat to begin with. They might put their foot over their little toes and then just move their big toe. And then after they get pretty good at that, they can usually find they can do it on their own.
Okay. You mentioned the main thing you look at is calf flexibility. Is that one of the major risk factors that you see for developing plantar fascia pain?
Most people who have this condition have some kind of calf problem. So when we have that, it's all about overload. So that ligament fascia at the bottom of our foot, it's always, if it's being overloaded, you're going to get pain. So, and it's usually from the calf pulling up that heel.
Okay. And And now there's a newer technology, I'm not sure if you use it too much, but shockwave therapy, in which it seems to have some results. Is that something you use? Is that something you recommend?
Absolutely, quite frequently we use shockwave.
Yep.
Again, it's a relatively low risk reward things in the right person.
Yep.
We avoid people who have blood clotting issues.
Mm-hmm.
That's really, and pregnancy, really the only main contraindications. Just helps to give people that buffer of pain relief to kind of like a massage therapy or joint needling,
Yep.
to give them that buffer so they can get their exercises done. It also just helps to stimulate some blood flow to the area,
Yeah.
and stimulate some new tissue regeneration in an area that has become kind of chronic.
Yeah, excellent. So it's mainly beneficial in more of those degenerative or those chronic circumstances?
Correct, but it isn't a treatment that should be used in isolation. It's something to add onto a many-pronged approach. I think the strengthening is the big one.
Yeah, great.
That one, but the shockwave really helps to get people over the line.
When implementing a multi-pronged approach or multiple facets to your treatment plan, what are your thoughts on manual therapy's role in, mainly osteopathy's role in managing plantar fascia pain?
Yeah, I think it's really important. So not all podiatrists are well trained in mobilisation somehow, and I think that's where the osteo really shines.
Yep.
Given that it's getting as I talked about, those midfoot joints being the shock absorbers before and getting good ankle range, dorsiflexion range, I think some osteopathy treatment can be really helpful in getting those joints moving and helping with that shock absorption and that normal foot function that we want to, as close to normal as possible to help offload the plantar fascia.
Yeah, I guess in combination with getting the joints working better, the immediate pain relief, and some of the stuff you do through management from orthotics and exercise rehab, you've got like a nice overarching approach to managing plantar fascia pain.
Yeah, definitely. So I think a multifaceted approach is always a good thing, because one treatment in isolation tends to be good, but you're not addressing all of the factors in treating someone one way.
Yeah. Excellent. Well, I appreciate you talking to me today, Adam, the podiatrist. I appreciate you talking to me, sharing some of your insight on how you guys would manage plantar fascia pain.
Anytime, all right?
Appreciate it.